Keith Hill. I'm Director of the Rehabilitation, Ageing and Independent Living Research Centre. Ageing and ageing well are very important at an individual, organisational and societal level. Ageing well doesn't just start at the magic age of 65, but it is dependent on much of what we do in earlier ages as well as in later life. The research that we do in the ageing stream of RIAL Research Centre is very diverse in its nature, and that reflects the diversity of ageing. But I think we can summarise it into two main areas. The first is around the individual who is ageing, and the second is around the health support and services around the individual to support them to age well.
We've just completed a study with the WHO, the World Health Organization, about how COVID-19 has affected assistive technology users. And we talked to nearly 150 people who use assistive products like walking aids, glasses, hearing aids, or prosthetic limbs. And we employed researchers for this study with lived experience in every global region. So we had people in Afghanistan, South Africa, Peru, the Philippines, Europe. And our research group included disabled persons organisations from across the lifespan, but with a particular focus on ageing brought to us by our colleagues from Help Age International. And our data showed that people, regardless of age, have a lot of challenges in common, but the people who are ageing into disability and ageing with disability, they have really specific skill sets and capabilities, but also needed very particular support. These results are being published now and will also inform WHO policy.
In addition to this project, over the last few years, I've been working with a couple of health services on developing and evaluating mobility programs for patients in hospitals. It's a really challenging space to work in, and the barriers and enablers are quite complex and often tied up with hospital policies. But I've seen that you can make really huge improvements to people's hospital experiences with relatively small changes. And so I'm really inspired by the work.
In addition to these projects, I'm currently working on the Embrace project funded through the Melbourne Ageing Research Centre. And this is looking at the impact of restricted access to aged care facilities on care partners during the COVID-19 pandemic. We've interviewed 32 care partners who are aged between 31 and 86. To explore their experiences of visitor restrictions and their perspectives of the barriers and enablers to maintaining engagement with their loved one during the visitor restrictions. And we're subsequently conducting some co-design workshops at the moment with care partners and also aged care facility staff to explore ways in which residential aged care providers can support the engagement of care partners with their loved ones in the homes whilst there's visitor restrictions in place. And this will assist us with the development of recommendations to support the care partners' engagement during a period such as this in the future.
I'm currently working on a project that involves co-designing and evaluating an exercise program for home care clients with dementia that is deliverable by care support worker who will be trained to do so. The co-design phase has involved an expert panel which consisted of industry representatives, consumer representatives, clinicians and researchers.
One thing that I've learned about more in recent years is ageism and how pervasive it can be in society and in clinical settings too. And what I've learned from this is that it's really important to speak to older people about the perspectives on the care that they receive. One of our recent studies we did on mobility in hospitals included interviews with patients and staff, and their opinions were often really contrasting. So some staff that we spoke to thought that patients were just not really motivated to get out of bed and move around, and so thought that patients needed a little bit more encouragement. But when we spoke to the patients, it was far more complicated than that. What we heard from them was that they felt like they'd get in trouble if they moved around too much and just didn't want to get in the way of staff or add to their workload. And really, most of them couldn't wait to get out of bed and out of the hospital. So I think that when designing health interventions, it's just so important to do the groundwork by speaking to consumers first.
One of the key learnings to me, from the research that we've been doing in the ageing area, is around the diversity of the ageing population. And that means that our research also needs to accommodate diversity and not try to adopt a one-size-fits-all. The potential impacts of the research that we conduct is really to achieve high-quality research that has a strong co-design and engagement with consumer focus that is throughout the whole research project, from concept through to implementation through to translation. And also that research will have a strong influence on policy and practice so that all Australians have the best opportunity to age well.